Keyboard.
Oh boy.
Il va manger. C'est super bon.
C'est bien. Pas pour moi.
All right, so welcome everyone. My name is Corey Lubring and I'm the PBR coordinator at DO-Touch.NET. For those of you online, my back is facing you, I do apologize. Thank you for joining us for this month's episode of Let's Talk About OMM Research. Before we begin, let's take a moment for the housekeeping rules for the webinar. For those of you online, feel free to introduce yourselves in the chat and tell us where you're from. For those of you that are here with us in person here at AT Still, we want to welcome you. They are joining us from the ASO that they are participating in with the Research Institute. So welcome all of you to today's session. We invite, for those of you online, to please feel free to turn your cameras on, so if you would like, so we can be united as an OMM research community. And if you're experiencing any technical issues during the webinar, please put a message in the chat. And if you have any questions or comments during the presentation, please feel free to type them into the chat as well, and we will address each other's questions or comments there as well. Also, we will have time for discussion and questions at the end of the presentation. Please keep in mind that this webinar is being recorded and will be placed on the public DO-Touch.NET YouTube channel. But today is our Let's Talk About OMM Research educational webinar about osteopathic practitioners, estimates, and rates, or the OPERA project with Patrick Van Dun. Patrick has a private practice as an osteopath in Mechelen. I apologize, I'm probably going to pronounce these incorrectly. In Hubbardswald, he is a board of trustees member for the Center of Osteopathic Medicine Collaboration in Italy, which is an interdisciplinary foundation for osteopathic excellence. He is also the chair and co-founder for the Commission of Osteopathic Research, Practice, and Promotion, which is a nonprofit organization that promotes osteopathic scientific research in Belgium. And he got his master's in science degree in rehabilitation and physical therapy at the Catholic University in Leuven, and completed his osteopathic studies at COC and organized at the Free University of Brussels. Previously, he's lectured at several European osteopathic education institutes and has been the scientific director of the German College of Osteopathic Medicine from 2000 till 2006, and the head of research of osteopathy for the Danube University in Austria from 2010 to 2012. So please help us welcome Patrick Van Dun.
Thank you, Corey, for your kind introduction, and good morning to you all, and bon appetit. I thank DO-Touch.NET for inviting me to talk about the OPERA project, and I feel honored to be here with you and by this invitation. And at the same time, I hope you will forgive my modest knowledge of the English language, because I'm not an English speaker. So I'm going to share my screen now. Do you see my screen? Okay, thank you. So, as Corey already mentioned, I am an osteopath with a clinical private practice in Belgium and in Germany as well. And I'm also an independent researcher and a board of trustees member of COM Collaboration. I have indeed taught at various European osteopathic education institutes for about 17 years, but not for the last 8 years. So what we will talk about in this presentation, we look at why profiling our profession is important. Then we will look at how to collect data for this profiling. And I will do this using the OPERA project that we at Foundation have been working on for the last 10 years. I will then report on some of the results of this work and conclude with some interpretation of the findings and, of course, a roadmap for the future. So my first question is, why is profiling osteopathy useful? When we provide a description of osteopathy and osteopathic care, we have information to provide to other people so they can understand what osteopaths do. Describing osteopathic patient profiles is also important for ourselves and to understand our market, but also for other people to understand who we treat and why. But this kind of information is also important for understanding the role that osteopathy can play in the healthcare market. So things like what osteopathy can offer to their nation's population, healthcare. And also it's about meeting the needs of our patients and meeting the needs of the communities of people that osteopaths serve. It is also important that professional associations, regulators, government agencies, and academic institutions can make informed decisions about developing policies and strategies. So profiling is also useful internally for various professional bodies to start looking at the future and the strategic direction of osteopathy, and of course, it is useful for defining research needs. So what are osteopaths and how do they work? Well, we need this information and we need it clearly, and we need it in a way that other people can understand. We need to clearly describe what we do so that other healthcare professionals and the public can understand what we do. In terms of the future of osteopathy and in terms of planning, again, we need to consider what osteopaths offer and what they can offer maybe in the future. And also in various countries, the number of osteopaths are either remaining stable or falling or growing. So osteopathy is a very small profession in most countries, and we need to think about the sustainability of our profession and our growth. This kind of profiling will help with this. So the Osteopathic International Alliance, for the first time in 2013, provided a global view of osteopathic practice. And in 2014 in Austin, Texas, the International Osteopathic Research Network within the OIA made it a top priority to compile evidence about scope of practice in osteopathy internationally. Although this was an important preliminary stage in describing the scope and the characteristics of osteopathic practice, this approach produced a significant reporting bias, particularly in those countries where the unregulated nature of osteopathy is still a major concern. So just to give you an idea of the surveys that have been done in the past, here is a table in the thesis of, in the professional doctoral thesis of Dorneden, Ralph Dorneden. His research it identified 54 studies between 1985 and 2017 using questionnaires that profiled osteopaths, osteopathic practice, or osteopathic patients. Most of those studies were conducted in regulated countries, and 75% of those studies targeted osteopaths and/or their patients. I did a quick search to update this information and came up with another 20 publications profiling osteopathy. So what I'm about to present to you is an example of such survey, one that has already been carried out in 7 European countries and is thus the most widely used questionnaire to date for profiling the osteopathic practitioner. This survey of collaboration is called the OPRA, or Osteopathic Practitioners Estimates and Rates. More information about the survey and the studies already carried out can be found on the OPRA website. Now, the OPRA is an online survey for osteopathic practitioners across Europe and beyond. Why do I say and beyond? Because We also have people from Brazil and Canada that were interested to run the OPRA survey. So our mission is to collect data from all osteopathic practitioners in Europe and beyond. And we know that using the same questionnaire allows for better international comparison. The questionnaire is currently available in 6 different languages, contains 52 questions in 7 different sections, such as socio-demographics, work state and professional activities, education, professional identity, fee and consultation structure, the patient profile, and osteopathic skills. It all started with a survey developed by the Belgian Healthcare Knowledge Center in 2010 on behalf of the Healthcare Ministry to survey osteopathy and chiropractic at that time. This validated questionnaire was based on pre-existing surveys, some of the studies in Dornley's table that I showed you earlier. So only 3 years later, in 2013, we conducted the Benelux Osteo Survey. Benelux stands for Belgium, the Netherlands, and Luxembourg. So those are 3 countries in the middle of Europe. And we conducted the Benelux Osteo Survey in 2013, focusing solely on the osteopathic profession, not on the chiropractic profession, and looking for information that was important to the profession at that time, especially what safety was concerned, diagnostics, and examinations and treatment of sensitive body areas. So the Benelux Osteo Survey questionnaire was the basis of the first OPERA survey conducted in Italy in 2017. With experience from the Benelux Osteo Survey, adjustments were made to the questionnaire. And the OPERA questionnaire has been adapted 3 times in the last 5 years to collect the most useful data for the profession and stakeholders, and which continue to adapt with advancing knowledge and insights. So this is an overview of all OPERA surveys from the past 5 years. All of them were published in peer-reviewed journals. And our next OPERA is scheduled for an update, is an update for Italy, and the first one for Brazil later this year. And there are also currently talks to progress to carry out the OPERA in Canada as well. So looking at all practitioner-based surveys that have profiled our profession over the last decade, 11 European countries and Australia with a similar scope of practice were surveyed. The studies highlighted in red now, those are OPERA studies. And apart from some adjustment made, all those studies were very similar. Because the Dutch study was part of the Benelux Osteo Survey that served as the basis for the first OPERA questionnaire, there is also a fairly good comparability for this survey. And I was also part of the research team of the German survey, so this also applies for the comparability of this study as well. So looking at the other Osteopathy Europe member states now, there is still room for progress. So we have still a lot of surveys to run. Now, I won't bore you too much with the methodology for conducting survey research, but I have included 2 slides to give you an idea of what a survey is about and what pitfalls one should be aware of. So, especially for those who want to carry out the OPERA survey in their country, this is an overview of the different steps involved in this implementation. You see, it is not only about filling out an online questionnaire and that's it. No, we first have to establish contacts and sign agreements with osteopathic institutions. Then we set up a promotional campaign that will continue throughout the whole study. We manage and coordinate the local contacts. Usually there are representatives of the osteopathic institutions we have contacted. And then comes the translation of the questionnaire. The online survey platform needs to be optimized, and then we are ready to pilot the questionnaire, which is a very important part of the project. Usually there will be two pilots, one with representatives of the contacted osteopathic institutions, and a second one with randomly selected osteopathic practitioners. The aim of these pilots is to validate the questionnaire, that is to ensure that everyone understands the questions, the words, and the technical terms. The questionnaire is then adapted accordingly and is then ready to be put online for completion by the osteopathic practitioners. And after a few months, the data will then be analyzed and a basic report is written, and finally a scientific publication submitted and hopefully published. So what are the pitfalls in conducting this survey? First of all, one has to prepare the profession, both in regulated and in non-regulated countries. The more professional associations or educational institutions there are in a country, the more preparation is needed. Everyone has to be convinced of the importance of this survey, and trust has to be built between the different stakeholders, so that the entire profession can be mobilized for this project. This is very important. All this is also important for the funding of the project and remains important throughout the entire process of the study. From a methodological point of view, the translation, validation, and piloting of the questionnaire are of utmost importance. As far as the recruitment process is concerned, the bottom line is to be as inclusive as possible, especially in a non-regulated country. Any practitioner who describes himself or herself as an osteopath, regardless of his or her training and academic degrees, is eligible to participate in the survey. That is very important. Finally, one should always be careful when interpreting the findings. One should always return to the original question asked, and the conclusions may only relate to the respondents and not to the whole population of osteopaths in that country. Okay, what do we know so far? Well, I've taken some results from the 11 European countries, plus Australia, that have profiled the osteopathic profession over the past decade. And first, let's look at some practitioner and practice characteristics, such as the age and sex of the respondents of the surveys. Clearly, these results show that the UK has the oldest osteopathic population, and the southern countries, such as Portugal, Italy, and Spain, have the youngest. So this could mean that the profession in the southern countries is younger than in the UK, which is in fact true. But France is an exception to this, because in continental Europe, the profession is the oldest in France. And yet the vast majority of respondents appear to be pretty young. So this is mainly due to the huge explosion of graduates starting in 2007, which has resulted in the current population of about 35,000 osteopaths in France, the largest number in Europe, as compared to the 5,300 in the UK. So remember what we said about sustainability and growth of the profession. Thus, the profession in France has grown rapidly over the past 2 decades, and in the UK, we see the profession being sustained as best. The female or male predominance of practitioners is fairly evenly distributed across countries. By far, the most female respondents were found in Austria. I will come back to the feminization of the profession later in this presentation. So, a little bit more about these practitioners. You can see from the data in the first column that in almost every country that over half of the osteopaths worked on their own, most of the time. So the vast majority also worked as an independent practitioner in a private practice. Only in Australia, Luxembourg, and Spain do the majority work in a team. Respondents saw on average between 20 to 35 patients a week, and the time spent with their patient was around 45 minutes on average. So osteopaths do spend quite a lot of time with their patients, and sometimes even more for an initial consultation. So these figures are for a consultation from a returning patient. So an initial consultation is sometimes around 1 hour. It is clear that osteopaths working in countries where the profession is younger or where there are more younger osteopaths active have fewer consultations per week, which may indicate that they are still building their patient base. But there are also other factors that may play a role. For instance, in Belgium, we have two cultural regions, and the north of the country is the Dutch-speaking region. They tend to have more consults a week than, for instance, in the south of the country, which is a French-speaking region. So there are also cultural differences that may play a role. In terms of the patient characteristics, we can see that all ages were represented and that more females than males visit osteopaths. The majority of patients are working age adults, which is, I mean that between the ages of 18 and 65. Interestingly, around 10% of all patients were reported to be pediatric patients between the age of 0 and 2 years. This is a typical graph. This is one for the Opera France on the age groups of patients visiting the osteopath, and we see similar graphs with other operas as well. So typically a high peak of working adult patients and a more moderate peak of pediatric patients. So people who were visiting an osteopath mostly suffered from musculoskeletal complaints, especially neck and lumbar complaints. That is very obvious. But patients also consulted for non-musculoskeletal complaints, such as headaches, gastrointestinal, pediatric complaints, for instance. For instance, for the pediatric complaints, 40 to 60% of all these pediatric patients presented with unsettled babies. That means babies with colic. We also know from patient-based data that around half of all osteopathic patients had other coexisting conditions, and over half of the patients seen by an osteopath were chronic pain patients. These are persons who have their chronic condition for 12 weeks or more. These are quite a lot of patients presenting with long-term persistent conditions. So let's look at different diagnostic and treatment techniques used by osteopaths. So the Oprah questionnaire listed all these different techniques and asked participants to indicate on a 5-point Likert scale how often they use these techniques. The work we are doing at the moment in the International Consortium on Manual Therapies, ICMT, will certainly modify the treatment techniques list in the future. Anyway, the care that osteopathic practitioners deliver as a package of a variety of these techniques, plus advice, plus guidance, so we can look at what osteopaths offer in their practice as a multi-component complex intervention and as a package of care. I promise that this is the most complex table of this presentation. I won't do it again. There's lots of information here. So Of course, it was impossible to list all these 16 diagnostic and 11 treatment techniques from the questionnaire here in this table. Therefore, we looked at the 3 most commonly used techniques in each country. So at the top, you see all the countries: Italy, Germany, Switzerland, Spain, Belgium, Portugal, Austria, France, UK, and Australia. And those countries in white are the OPRA countries, and the other are non-OPRA studies. And then we have at the left diagnostic techniques and treatment techniques. So we looked at the 3 most commonly used techniques per country, and those are the numbers in red, and came to the conclusion that palpation is the most commonly used diagnostic technique. So palpation of tenderness, palpation of structure, palpation of movement are the most commonly used diagnostic techniques. In terms of treatment techniques, there is a marked difference between the UK and Australia compared to continental Europe. So in the UK and Australia, they use more classical techniques such as an HVLA or articulatory or soft tissue methods and MET, so Mitchell techniques. And in continental Europe, these are mainly articulatory and visceral techniques. So these are the main differences between those 2 regions. So having collected quite a lot of data over the past 5 years, we are currently working on the analysis, secondary analysis of OPRA metadata in collaboration with some master students from the University of Applied Sciences in Fribourg in Switzerland. And we hope to complete this analysis this summer and submit a paper by the end of the year. The possibilities for further research using this metadata are seemingly endless, and we have just begun this process. In what follows, I will try to give you some examples of how this data can be interpreted and used for policymaking and further research. So my first example is that of professional profiling. Here we see that only a majority of survey respondents from 3 out of 7 countries, that is Italy, Belgium, and France, advertise themselves to the public exclusively as osteopaths. This certainly raises some questions such as, how then can the profession manifest itself as a separate healthcare profession when their practitioners do not profile themselves as such? Even when an overwhelming majority were to advertise themselves mainly, does not exclusively, but mainly as osteopaths, how would they be perceived by the public then? As a physician or a physiotherapist who might provide some osteopathic care? So, if so, osteopathy may not be perceived as a separate profession, but as a medical act or procedure performed by a professional better known to the public as a physiotherapist or physician. So this creates a blurred image of the osteopathic profession and calls for action. One possible explanation for this blurred image of the osteopathic profession could lie in the osteopathic training, of course. The more full-time training is offered, the less it is possible to fall back on a prior healthcare profession. You can see the numbers of France, for instance. They have almost 90% of full-time education. Yeah, and then they exclusively profile themselves as osteopaths. So the social status of an already recognized profession, such as physiotherapy, for example, may also have an influence on this. If you see the percentage of preliminary physiotherapy training, yes, for France, it is 8.8, and for Spain, for instance, it is 75%. That is the huge difference. So at first sight, this picture seems to hold true for many countries, except for Portugal and also to a lesser extent for Belgium. So further statistical analysis should clarify this and maybe look for yet other factors that may play a role in this blurred image. Also, what does it mean when, in some countries, the majority of osteopaths use supplementary methods? This table gives us an overview of the use of supplementary methods in osteopathic practice in different European countries. We see that in 4 of the 7 countries, the majority of respondents made use of such methods. Most of the time, these methods come from physiotherapy, such as taping or exercise programs. Does this mean then that these methods have a claim to be included in the usual osteopathic scope of practice? What when these methods are not really an extension of what is generally considered to belong to the scope of practice for osteopathy? So methods such as dry needling or electrotherapy, for example, in the UK. What does this mean for the identity of the profession, the regulatory process in unregulated countries, the training of osteopaths, the insurance of the practitioners, and last but not least, the relationships with other health professions that also use these methods, for instance? It may not be a good idea to become active in the field of long-established health professions. So this is why in my country, in Belgium, this is why it was decided in Belgium that osteopaths, for example, should not offer functional rehabilitation, no penetration of the skin with any type of needles, no treatment of mental health, and no prescription of drugs. In this way, we do not challenge the field of other health professions. That is what we chose for in Belgium, for instance. Talking about the blurred image and identity problem, let's have a look at the latest US survey about the use of OMT among osteopathic physicians. For this survey, 10,000 osteopathic physicians were invited and 1,683 responded. The majority of these osteopathic physicians didn't use OMT on any of their patients, and 78% used OMT on less than 5% of their patients. Compared to a 2001 study, this all represents a reduction in OMT use by approximately half. Since the use of OMT is one of the key features to distinguish a DO from an MD, this seems like a big problem for the osteopathic profession in the US, doesn't it? So, of all countries surveyed with the OPERA, only Belgium was surveyed twice with an almost identical questionnaire. So we had the Benelux Osteo survey in 2013, and we had the OPERA survey in 2018. So let us compare some data from the 2013 and the 2018 surveys, and assess the evolution of the osteopathic profession of this over this 5-year period. So in this 5-year period, no political or educational changes were during this 5-year period were there. So just a merger of 4 professional associations into one, reducing the number of professional associations from 7 to 4. That's the only thing that's happened during this 5 years. As mentioned, both surveys are fairly identical. The only additional section on professional identity and views as an osteopath was included in the OPERA 2018. The main difference between the two surveys was the poor response rate of the 2018 OPERA. So let's have a look at the main differences found between both surveys. I promised to talk about the feminization of the profession, a phenomenon that, by the way, occurs in almost every health profession. A gender shift in the youngest age group relative to older age groups is something that we see in all OPERA studies. So this calls for a feminization of the profession. But here we see that a progression over a 5-year period with a gender shift in the 30 to 39 age group, which in 2013 was only seen in the 20 to 29 age group. Considering training characteristics, we see a 10% increase of full-time training and a 17% decrease in respondents with prior physiotherapy training. Let's see how this data affected our communication with policymakers in the context of a pursuit of regulation of the profession. So on one side of the table, we have policymakers who didn't know anything about osteopathy and said, okay, guys, if you don't have proper training in primary medical care, you can't be regulated. That's true. On the other side of the table, you have representatives of the osteopathic profession telling them, okay, we have done our survey and the data show that a large majority of Belgian osteopaths already have a master's degree in physiotherapy. And on top of that, a 5-year part-time training in osteopathy. So this is a solid argument for regulation of the profession. And the fact is that a master in physiotherapy in Belgium, for instance, is seen as a medical profession. So, but since 2018, we have had a new survey which provides us different data. So how did we change our communication strategy according to this new data? Now representatives of the profession focus more focus their attention on the full-time training and provide detailed information about the full-time training. This communication shift from prior physiotherapy training to full-time osteopathic training also means that this training must pass the test of robustness to be regulated as primary healthcare profession. But this is an entirely different discussion. In any case, it creates more of the profession's own identity when one does not have to hide behind a prior different healthcare profession. So what's next? As mentioned before, many European countries have yet to be surveyed. Updates of the survey every 5 to 10 years, as we have done in Belgium, may also reveal the evolution of the profession. And we are now doing a secondary analysis of the metadata to answer some of the questions we have, such as how does the aforementioned feminization affect the profession? Will it affect the way osteopathy is performed, for example? And the first data on this let us see that there is a huge difference between the techniques that are used between female practitioners and male practitioners. We also hope that this project increases the opportunity to homogenize the various relevant osteopathic aspects that are important to patients, osteopathic practitioners, institutions, stakeholders, and policymakers. So I thank you for your kind attention, and I'm ready to answer your questions.
Sorry, working with two keyboards, I'm having some difficulties unmuting myself. I apologize. Just a few reminders before we open the floor to all attendants for questions and discussions. If you would like to speak during the discussion, please raise your emoji hand if you're online, or raise your hand in here if you have a question in the conference room. And if you're online, your emojis are located at the bottom of the screen under the reactions menu. We ask that you briefly introduce yourself, and then please feel free to turn on your camera if you're online. When contributing to the discussion, please limit your microphone time to 3 minutes to allow for everyone who wants to participate in the discussion. We'll provide a timer on the screen to assist you with keeping track of your time. And after everyone has had the opportunity to make comments or ask questions, there may be additional time for more comments and questions. And us moderators, myself, we will be happy to read your questions or comments out loud if you would prefer to type them into the chat. And please feel free to address each other's questions and comments there as well. There's a question here in the chat from Amy Dean that says, Has there been any European research on hospital-based OMM that is similar to this study, like what you see as diagnosis? What types of patients do you see in the hospital, and how long sessions last?
In Europe, there are hardly osteopaths who are working in a hospital. So almost all osteopathic practitioners work in a private practice and mostly independent. So, and there are some of them, they are working in a hospital mostly in specialized departments such as urology or let's say pediatrics also.
Right.
But those are only a few.
Wow. Okay. It's kind of like that here as well. It's not as common as you think, even though we have full privileges.
Yeah.
Thank you for answering my question.
It is, let's say that it is progressing. So they're opening more and more, even in Belgium, for instance, in Belgium, we are an recognized but not regulated profession still. So we were recognized in 1999 and we are still not regulated. So Belgium is a very strange country, very surrealistic, but it is what it is. And even there are some departments who are opening their doors, and especially in pediatrics. So let's say the influences we have in pediatric patients are well received in the hospitals. Yes.
All right, thank you. We had a question in the chat from Hallie Robbins. Did you want to read yours out loud, Hallie?
That's why I raised my hand. Thank you so much. So in terms of international versus US, there is such a difficulty for having time scheduled or reimbursement and even having a template for your work. Anyone who is in training needs to have a supervisor. So there are many different log jams or hindrances for why people practice and why they do or don't continue past training time. Is that a similar problem in international osteopathic communities? And how does reimbursement affect that? Are there capitations or limits on how much an international osteopath will get coverage for if their country allows for osteopathic access?
Most of the time in Europe, osteopathic care is private paying. So all the patients pay themselves and there is a little reimbursement sometimes. And if you're a privately, if you have a private reimbursement, then you get paid for the osteopathic care. But normally it is not done. But we have no problems in this. Let's say that we ask in Belgium, we ask around 50 euros for a consultation, and the patient gets 10 euros per session with a maximum of 5 sessions a year. So that means nothing. So if you're privately insured, then you are reimbursed, but not from the public. No.
Thank you. We had a question from Jed Down. Oh, sorry, go ahead.
Did I answer your question? Okay.
We had a question from Jed.
Yeah, my question is, how well does the European populace understand what osteopaths are? I work in sort of the north central United States, where there are at least 4 or 5 states where nobody knows what an osteopath is. And so to identify as an osteopath puts me sort of in a position of having to explain myself a lot to the people who do come and see me. So I was wondering how widespread that understanding is in Europe.
We have done another survey. For Belgium, for instance, we have asked 2,000 Belgians what they know about osteopathy, and their knowledge about osteopathy was very good. So 60% very well knew what osteopaths do, what they're there for, and so on. So the knowledge is pretty good. With 35,000 osteopaths in France, for instance, most of the people in France, for instance, they know very well what an osteopath does. Yes. Yeah. But even though there are still 40% who don't really know what an osteopath does. Yeah. And what was very interesting in this survey is that patients wanted to get more information of their general practitioner about osteopathy. So we have to make ourselves more known by general practitioners, also by the medical profession, because they want a patient wants most of their information from a general practitioner. So the collaboration between the different healthcare practitioners is very important to the patient.
Thank you. Mr. Ellis, you had your hand up before. I just wanted to make sure if you had a question that we acknowledged you.
Yes, excuse me. I was going to give my opinion about what was happening in France about the reimbursement, but I guess that's passed already. I was wondering if Mr. Dunn would give us his opinion about the future of osteopathy in Europe, because he seemed to think that it was progressing in some countries and regressing in others.
Not regressing, but there are questions about the sustainability of the profession sometimes. Yes. If we see France, for instance, it is an explosion of osteopathy in the last 2 decades. Yes. And I'm pretty positive and confident for a good progression and a fine future. But the most important thing is its training of osteopaths. So the training is very heterogenic in Europe, and in my opinion, that is the most important thing, to homogenize the training and get a master's degree for osteopaths. That is very important. If I see the legislation in Italy, for instance, that has been approved, so for now it is possible to train osteopaths in a 3-year time period on a bachelor degree, and that is simply not realistic. And on the other hand of the continuum, you have, for instance, in Belgium, a 6-year full-time university program, and those students graduate with a double master, so a master's in motor sciences and a master's in clinical osteopathy. So those heterogeneity into the training of osteopathy, that is not good for a profession, and we need to homogenize this situation. We have done a good thing with the SEN document. The SEN document is a European standard on training and how to practice osteopathy, and that is a very good thing. But after a 5-year period, so the SEN document was was approved in 2015. After a 5-year or 8-year period, I still see that private institutions still have problems to reach their goal of 1,000 clinical hours. So those are problems and they need to be solved. If those problems are solved, then the future for osteopathy looks bright, yes.
Thank you.
We had another question in the chat from Hallie Robbins. Did you want me to read it or? Wait, the question was, the massive gender shift and technique shift, is this converging towards physical therapy? Do people select physical therapy versus DO for musculoskeletal conditions?
No, it is a question about the techniques that we asked, the 16 diagnostic techniques and the 11 treatment techniques, not the supplementary methods. So to give you one scoop, I just got this information a few weeks ago about the analysis we did, the secondary analysis. And we thought that with the feminization of the profession, we already saw that there was a huge difference between male practitioners and female practitioners in their choice of techniques. And we thought, our hypothesis was, okay, if more female practitioners, if the profession gets more female practitioners, then it would change the profession to be more, let's say, soft in technique choice. So high velocity, low amplitude thrusts, for instance, would not be performed as much as it used to be. And what we saw that was that it was the other way around. So female practitioners tend to use HVLA more often than male practitioners. That came as a surprise to us. So 200% more. It was huge. So I think we will receive a lot of surprises by the secondary analysis if we continue this process. And that's why these analysis and these surveys are so important to get an idea of okay, what is the profession going to if the profession feminizes even more. So it's really important, I think.
All right, thank you. Are there any other questions anybody has? All right. Well, we have come to the end of our discussion. So don't forget that this webinar recording will be placed on the DO-Touch.NET YouTube channel, where any discussions can continue. Watch your email for an announcement when the recording is available if you want to partake in any discussions or catch any clips again. We want to thank Patrick Van Dunn for his wonderful presentation. And our next episode of Let's Talk About OMM Research will be a Journal Club episode on June 16th of 2023. So we'll see you then.
Thank you. Bye.
Thank you.
Thank you very much. Goodbye.